A record number of Minnesotans now have health insurance, and those without coverage is at an all-time low.
That is the finding of a new survey done by the State Health Department and University of Minnesota. Leaders credit the Affordable Care Act, the state's Uninsured program, and Medicaid expansion. But as Bill Hudson explains, reaching the 234,000 Minnesotans still without coverage will take a different approach.
Who are the people who fell through the cracks?
For 10 years, self-employed artists Ken Avador and his wife lived the gamble without health insurance. By enrolling in Uninsured, they became covered and helped push down the number of Minnesotans living on the edge.
Being insured has enabled us to have that preventive care, which would prevent that kind of big hit where we'd end up at the emergency care.
A recent survey of 11,000 households finds the number of uninsured in the state is at an all-time low. From a high of 9% without coverage just 5 years ago, Minnesota's uninsured rate is now down to 4.3%. Health Commissioner Ed Ellinger says it means over 200,000 more people have health coverage than just 2 years ago.
All groups of Minnesotans, regardless of income, race or ethnic group or age, reported improvements in health insurance coverage.
Much of the credit is the improved economy and more employers offering coverage, but roughly 1 in 10 Minnesotans now gets coverage through Uninsured.
There's still work to do. The underlying cost of healthcare are rising, so we need to figure out both how to manage premium growth and how to manage the cost of care.
Ken Avador's finally getting the checkups and procedures he's been putting off. Just one statistic painting the picture of a healthier state.
And the Uninsured and the Affordable Health Care Act allowed us to get back into the system.
Now, they say the next challenge is convincing those still uninsured to enroll for coverage, particularly the Hispanic, Black, and Native American communities, which have higher numbers of uninsured. In fact, over 20% of these people may be eligible for premium tax credits, but they don't even know it, so they have to reach those people.
Yeah, that'd be a good thing, right?
Let's get them signed up, you bet.
Okay, thank you, Bill.
Sure thing.